no, Mark, that is not good. Hey, you need to go and see Dr. Jamie Kaszer, because if you have a problem with your nose or your back or your feet, or you're just not feeling good, you feel like you have no energy, and we're talking about a treatment called Nuka today, and he can help you out. Thank you for coming today.
I can't, I saw the slow motion of that happening, like live, right, coming in, and I guess, yeah, I almost have x-ray vision at this point with doing this kind of work for about 10 years now. I could almost like see his head and neck misalign and shift as the face absorbs the soccer ball.
So that was actually on purpose, because it was a good segue for our segment here.
I'm paying him later for that.
Tell me what Nuka is for our viewers.
Nuka, every nerve in your body starts in your brain and has to pass through this very top point. Okay, and so if things are turned off up high, if there's interference up top, it's going to affect anything downstream. And so what we do with Nuka is take some very specific x-rays to figure out where in three-dimensional space everything is misaligned, so we can figure out how to put it back where it's supposed to be, so your body can work like it's intended. Yeah,
you know, I actually went in and had some x-rays with you, and it sounds so technical, and it is. It's very scientific the way that you do this, but at the end of the day, if you're not feeling good, if you're not feeling like yourself, if you want more energy, or if you're having extreme back pain or just a little back pain, you can help these people.
You and I were talking about this earlier. I mean, we've been on the show for about 2 years now, you know, about 50 different shows, and I think that pain is unfortunately the motivating factor, right? Like most people are, hey, I hurt, my lower back hurts, I've tried 55 different things, nothing's helping, I've got pain, maybe he can help. But what we do in the office is not just for people who have already had 2 failed back surgeries. I mean, yes, we can help that person when the surgery hasn't, but it's more about the mom who's sitting at home saying, you know what, I just don't have as much energy as I used to, and I'm curious, you know what, is this normal for my age, or could I actually get back to a better point? So if you're not happy with your health as it is, or if you're just mildly curious, we've tried to set our office up so people can have a really no-risk way of coming in to see what might be possible.
So we have a great offer for you today, and there are 2 locations so people can go.
We 2 offices now, one up in Encinitas, and then one down here in Mission Valley. So we're basically about 20-25 minutes away from basically anywhere in San Diego. But I'm a very analytical person, but I was thinking back over the last 3-4 years, if I was at home and if I'm in tons of pain, I'm really skeptical, or if I'm just tuning in, I'm like, more energy, kids, wait, how do I get that? I'd be curious, but what reservations does that person have? You know, they've probably spent a bunch of money, they've gotten their hopes up or hopes dashed, and so the format that we use now in both these locations, we do an initial orientation. So any new patient consulting our office, we do a small group setting, okay, because that helps lower barriers as well, where it's like, well, I just have to sit and listen, and then if it works for me or not. So we get, 2 to 5 people together. We do it at 6 o'clock at night, or we also do them around the lunch hour, and people come in, and I basically sit down and go over in excruciating detail, hey, this is what we do, this is how it works. We try to hit all those expectation levels. How long do I have to come? What about my insurance? Could you help me if I had X, Y, or Z wrong? Trying to just figure out for people what's the easiest way we can get them to take a chance to get to a better place.
And the interesting thing, when you have those orientations, you can look around the room, and I bet they're all in there for different reasons.
Oh, absolutely different reasons. I mean, we'll have probably 2 weeks ago, we had 5 people there up in Encinitas, and that ranged from a girl with really bad migraine headaches. There was a woman who had fibromyalgia, and there may have been a patient like with Parkinson's. I mean, the adjustment itself, what we're seeing on screen here, when we make the adjustment, I'm figuring out where to stand based in 3-dimensional space on some x-rays. The most force you're feeling, if you ever had your pulse taken, we're talking about slightly more pressure than that. But the most important thing, I think, and we have some graphics that hopefully given time here we can pull up, we do a lot of stuff in front of the mirror, okay? So you actually stand in front of the mirror, you can see your posture, you can see, actually the other one, if we could switch that over. So those are the before and after x-rays, but the other picture, you're standing in front of the mirror, and you may see one shoulder being higher than the other one. You may see, there we go. And some people look at home and they say, wow, that's me. Well, I've already been told one hip is off, my legs are uneven, my shoulders are off. We're going to check you in front of the mirror beforehand, and then after we get you adjusted, we have you stand up and look in the mirror again. So whether you're I've had 2 failed back surgeries and I'm skeptical, or whether you're the mom who's like, well, I'm just curious, what's possible, you can see a change. There isn't this long period of just blind faith of, okay, I got to commit to 6 months of stuff before I even see anything different. Things should change. And then the other picture we had up there was actually a couple of x-rays. Like I said before, we take the x-rays before to figure out where you are, and then after your very first adjustment only, we take one post x-ray. This is all very low dosage stuff. So we can go back and measure, did we get things right like we said we were supposed to?
Fantastic. So we're really encouraging you to head on down and go to this orientation
Right.
because there's so many more questions I'm sure people have.
And when people come in, I'd say probably 95% of people, when they come in, they hear the explanation, it makes sense. What we want them to do right now is call our office, the 847-3333. You're going to get our call center. And our call center is going to ask for a credit card to reserve your appointment time, but there's no obligation. You come in, you go to the orientation, and there's nothing out of pocket.
Sure.
So the first 3 visits we do for a total of $89. I mean, that includes the x-rays, it includes the first 2 adjustments, so people can come in, low barrier of entry, to get started, to see what this is all about, and then decide for themselves.
And sometimes that's all it takes.
To notice a change, absolutely, just to see that difference. Long term, how does our office function? Check in a month, 2 months, sometimes up to 3. Really depends on the individual. But bottom line is we got to get some changes first.
Yeah.
And if we get some changes going, people understand what's happening. They see the big picture about, wow, you know what? My back is doing a lot better, but my sinuses are more clear. I wasn't even expecting that was going to happen.
You see a lot of benefits, because it all works together.
It's your whole body working right, not just less pain. And pain is a motivating factor for most people, but what if there could be more?
Yeah, I want to be honest, what really attracted me to your office is I've actually been to a few other doctors. I was having really bad back pain, and they say, here, take this medicine. I'm not a medicine taker. I didn't like, I'm not going to take what
Where's the end point for the rest of your life? And how is, even if we found the magic pill, some of us out there are waiting for the magic pill. I'm going to wait till they get that surgery, that pill that's going to take away my migraines.
Right.
Even if you found the pill, it doesn't do anything other than take away the symptoms.
Exactly.
It does nothing else for the functionality of our whole body. So the mom that's got migraines, yeah, your migraines are gone, but your kidneys aren't still working right.
And you stop taking the pill and
it
come
comes back. So
yeah.
that's not a solution. That's not a system. And what we want in our office is people getting full life expression, not just less pain. And it's just so easy when people just to take the risk. The risk is the hard part about, do I pick up the phone and make a call? But it's once they get over that barrier, just coming in and sitting down, non-threatening environments, so they can just understand what's happening. That's why a lot of my patients currently love it like this, because when they refer like a friend or a family member, they try to explain enough, but it's kind of hard to get the big picture. So they just come in, and there's like no obligation. Come in, understand, and make an educated decision. Yeah,
no risk to you. So go on and see Dr. Jamie Kaszer. There's the information on your screen. The new patient special. The first 3 visits for only $89. What a great deal. So call today. You've got to call today, and they have 2 convenient office locations. Thank you so much for coming today.
You're welcome. And quick side there, remember, you are going to get our call center, so make sure you have a credit card available just to reserve that appointment time.
And that's no obligation, just to reserve the appointment time. But you're going to like what you have to hear. Thank you so much for coming.